Schizophrenia treatment. 1. Introduction. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for those around them. Schizophrenia is not as common as other mental disorders, but its symptoms can be very disabling. The impact of schizophrenia extends beyond the individual to their families and society at large, making it crucial to understand and effectively treat this condition. 2. Understanding schizophrenia. Symptoms. Positive symptoms. These are psychotic behaviors not seen in healthy people. They include hallucinations, delusions, thought disorders, and movement disorders. Negative symptoms. These are associated with disruptions to normal emotions and behaviors, such as reduced speaking, lack of pleasure in everyday life, and difficulty beginning and sustaining activities. Cognitive symptoms. These may be subtle or severe and include poor executive functioning, trouble focusing or paying attention, and problems with working memory. Diagnosis criteria. According to the DSM-5, a diagnosis of schizophrenia is made if the individual has two or more of the following symptoms, each present for a significant portion of time during a 1-month period, and at least one of the symptoms must be delusions, hallucinations, or disorganized speech. The ICD-10 criteria are similar, requiring at least one very clear symptom or two less clear symptoms from a specified list. Causes and risk factors. Genetic factors. Family history of schizophrenia increases the risk. Various genes are involved, and interactions between these genes and environmental factors are likely. Environmental factors. Prenatal exposure to toxins, viruses, malnutrition, stressful life circumstances, and drug abuse are some environmental factors that may contribute. Neurobiological factors. Abnormalities in brain structure and function, such as changes in the brain's chemical systems and problems with certain brain circuits, play a role. 3. History of schizophrenia treatment. The treatment of schizophrenia has evolved significantly over the centuries. Early treatments were largely ineffective and often inhumane. With the advent of antipsychotic medications in the 1950s, there was a significant shift towards more effective and humane treatments. The deinstitutionalization movement aimed to reintegrate individuals with schizophrenia into society, but it also presented new challenges. 4. Modern treatment approaches. Pharmacological treatments. First-generation antipsychotics. These include chlorpromazine and haloperidol, which primarily target dopamine receptors. They are effective but often cause severe side effects, such as tardive dyskinesia. Second-generation antipsychotics. These medications, such as clozapine and risperidone, target both dopamine and serotonin receptors. They generally have a better side effect profile but still pose significant risks. Mechanism of action. Antipsychotics work by altering the effects of neurotransmitters in the brain, particularly dopamine. Efficacy and side effects. While effective in reducing positive symptoms, these medications can have significant side effects, including metabolic syndrome, weight gain, and cardiovascular issues. Long-acting injectable antipsychotics. These are used to improve adherence to medication regimens, offering a sustained release of medication over weeks or months. Psychosocial interventions. Cognitive behavioral therapy, CBT helps patients manage symptoms by changing negative patterns of thinking and behavior. Family therapy involves educating family members about schizophrenia and how to support their loved ones. Social skills training helps individuals develop the skills needed to interact effectively with others. Assertive community treatment, ACT. A multidisciplinary team provides comprehensive, community-based psychiatric treatment, rehabilitation, and support. Supported employment assists individuals with schizophrenia in finding and maintaining employment. Integrated and holistic approaches. Coordinated specialty care, CSC. An integrated approach that combines medication, therapy, case management, family education, and support. Early intervention programs focus on identifying and treating schizophrenia early to improve long-term outcomes. Wellness and recovery programs emphasize overall wellness, including physical health, social connections, and personal goals. Use of technology in treatment. Telepsychiatry and mobile apps can provide access to care and support, especially in remote areas. 5. Challenges in schizophrenia treatment. Treatment adherence. Non-adherence to treatment regimens is a significant challenge due to side effects, lack of insight, and other factors. Managing side effects. The side effects of antipsychotic medications can be severe and may lead to discontinuation of treatment. Comorbidities. Many individuals with schizophrenia also struggle with substance use disorders, depression, and other mental health issues. Stigma and social barriers. Stigma surrounding mental illness can prevent individuals from seeking help and receiving adequate support. Access to care and health disparities. There are significant disparities in access to care based on socioeconomic status, geography, and other factors. 6. Future directions in schizophrenia treatment. Advances in pharmacotherapy. Research is ongoing to develop more effective medications with fewer side effects. Personalized medicine, tailoring treatment to the individual's genetic profile and specific needs. Gene therapy and stem cell research, potential future treatments involving gene editing and regenerative medicine. Novel psychotherapeutic approaches, innovative therapies, such as virtual reality therapy and cognitive remediation, are being explored. Role of artificial intelligence and big data. AI and big data can help in early diagnosis, treatment planning, and predicting treatment outcomes. 7. Case studies. Examining real-life case studies can provide valuable insights into the complexities of treating schizophrenia. Success stories highlight the potential for recovery and the importance of comprehensive, individualized care. 8. Conclusion. The treatment of schizophrenia requires a multifaceted approach that includes medication, therapy, and support. While there are many challenges, ongoing research and advances in treatment offer hope for better outcomes. Continued advocacy and education are essential to reduce stigma and improve access to care. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.